All right, we're going to come to lie supine, and I'd like you to place your anti-burst ball under your sacrum by elevating your pelvis up. And once it's under there, take your pointer fingers to the bony protrusions of your hips. And I'd like you to tip your tailbone towards your feet, arching it over the ball. Exhale as you do this. And then guiding those bony protrusions back, inhaling, not tucking the butt under like a scared puppy, but finding neutral pelvis. Exhale back to extension, reaching the tailbone towards the heels, arching over the ball. And watch out for the ribs spraying forward as you do this. Think about imprinting the back ribs and then the front ribs connecting to the back ribs so you close off the rib cage. Plug your shoulders down and open your throat a little bit by lifting the chin up so we don't get that closed throat. Hear your breath. We're going to close our eyes now and visualize a clock. Visualize the pelvis as a clock. And when you tip it to your left, it's going to start to go clockwise to 1 o'clock and then to 2. And when it's all the way to the side to the left, it'll be at 3 o'clock. And I'd like you to take your time articulating your pelvis as you move that clock back around to 12 o'clock. And this could be very, very slow, or you could move at a smoother tempo, but I want us to continue clockwise here. And use your breath. And once you get up to 12 o'clock, watch out for rounding. And when you're deep in extension, when your pelvis is at 6 o'clock, watch out for the ribs pushing forward. Keep them soft. I want you to learn to initiate the movement of the pelvis from your lower abdominals. We don't need to grip in our thighs or use our chest muscles or neck muscles to move our pelvis through space. So it's all about that isolation here. And in doing so, we're getting a nice stretch for the QL area. Go ahead and slowly begin your circles counterclockwise. And I like to keep my eyes closed because it relaxes my nervous system when I close my eyes and I focus on my breath. But if it's better for you to keep your eyes open, please honor what feels best to your body. Either way, we're moving our pelvis counterclockwise now, really opening up the lower thoracic and that QL area that gets stuck due to the pelvic flexion from the overactivity of the glutes and the hamstrings and all of that forward leaning that happens with flat back posture. From here, we're going to find our way back to 12 o'clock. We're going to inhale to lift our hips up, exhale to take that ball out from underneath the sacrum. And if your hamstrings are very tight, you can place the ball under your head before we begin our hamstring flexibility. You're going to grab your second to heaviest Theraband to help you out here. And you're going to lift, actually you're going to grab your heaviest Theraband, and you're going to place it around the arch of your foot, dorsiflexing it. Let's start with the dominant leg up. And imagine that ball still under your pelvis. I want you to tip your tailbone down like you did and reaching that tailbone now for the leg that's extended out long. You can check that you're not slipping into your pelvic flexion by sliding one hand under your low back and keeping a little distance between the low back and the floor. The ball is under the head to lift the head so the neck doesn't strain since we're holding this for a good amount of time. This is level 1 flat back posture, deep flexibility. So we're holding our postures for a minute and a half, which is a little longer than the flexibility for all of our other programs. It's typically a minute. And as the levels progress, the time you hold the stretches will increase. So tipping our tailbone towards whatever is in front of us, creating lumbar extension. We're breathing here. We're on our dominant side. Hamstrings are very tight for flat back posture. And hear your breath. Inhale to feel your pelvis pulling towards your heels or towards your heel of the leg that's extended, lengthening your torso. And then on your exhale, pull a little on the band to bring the leg closer. Keep the foot dorsiflexed. On your next exhale, bend the knee and slowly take that leg to the floor, and we'll switch sides. And tempo for switching sides is important. We don't want to do any crazy scissor leg kicks and aggravate the hamstring that hasn't been stretched. So we're going to move slowly, keeping ourselves safe. And as you're here, now we're on the non-dominant side. That you might notice a big difference in the flexibility. This side may be a lot easier to get it up to 90 degrees or past 90 degrees, and you're squeezing the quadricep to lift the kneecap. Watch out that we don't get extension in the knees and we don't get bow-leggedness. So if you do have some hyperextension in your knees and you're hypermobile, keep a little soft bend so we can really stretch the fibers of the hamstrings all the way up to the attachment at the top. Watch out for the pelvis rounding under. So decrease the range of motion of the stretch. Take that leg up a little higher and tip your tailbone down, reaching the pelvis towards whatever's in front of you, lengthening the side body out. Keep pulling the lower abs in towards the spine and feeling the pelvic floor muscles lifting up like you're stopping your stream of pee. About 10 more seconds here. And then I'm going to have you slowly bring that leg down, bending the knee first. We're going to you may need a bolster. Many people will need a bolster, a pillow, or a yoga block if your back is really tight, and that's typical of flat back posture. What I want you to do is you're going to hug in your dominant knee first towards the chest with the non-dominant leg extended out long, and we're going to take this leg across the body, bracing our abs as we do this. You can place a block or bolster under the knee once it crosses the body. So taking it across, and then your arms open to a T, you can keep one arm on the leg, opening it further, and the other arm out long, turning your head away from the knee that's on the floor. Nice stretch for the neck. Breathe into your rib cage here. And think about expanding the side body on your inhale, especially the one that's open now to the ceiling and sky, creating more space for the ribs there. We can get stuck in the lats and the upper fibers of the external obliques, and that can pull us even deeper into kyphosis. So just being aware of breathing into this. And I'd advise, if you have back issues, keeping your lower pelvic floor engaged, because you are really stretching the low back here, getting deep into that extension. And it's fine if you put a couple of bolsters under the knees, wherever you are, wherever you can get into this posture and feel a stretch and not pain. That's where you need to be right now. Keep breathing. And on our next exhale, actually, let's inhale to lift that leg up. Exhale to extend it out long on the floor. And we'll inhale, hugging our non-dominant knee in. Brace the abs. Exhale, take it across the body into our twist. Opening the arms into that T position. Palms can be up or down. Head is turned away from the knee. And we're going to breathe here. Inhale. And exhale. Feel free to shut your eyes. Quiet your mind. Hearing the breath. Sometimes counting the breath can be relaxing. Counting your inhale. How long is your inhale? Is it 3 seconds? Is it 5 seconds? And then keeping the exhale at the same tempo. Often we cut off our exhale before we've gotten all the air out, and then we gasp in the inhale. So try this. Inhale for 5, 4, 3, 2, 1. Exhale, 5, 4, 3, 2, 1. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Keep that going. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. 10 seconds left. One more set. Just keep breathing at that tempo. And on your next inhale, bring that knee up. And on the exhale, slide that leg down so both legs are extended now. You can have the ball under your head for this if your outer hips, your glute med area is very tight. If it's not as tight, you can set the ball to the side. We're going to come into a figure 4 stretch, starting with our dominant leg crossing over our non-dominant thigh. I want you to dorsiflex the foot, both feet rather. And if you have trouble holding your hamstring, I'd advise grabbing your heaviest loop band and bringing it around the bottom leg's thigh so you can pull it and your arms can be a little closer to your chest. That's helpful if this stretch is not accessible because of the range of motion. So I'm going to have this heaviest band around my bottom leg's thighs. I'm going to keep reminding myself, like with the hamstring flexibility, about the pelvis. Is it rounding under? Tip it towards whatever's in front of you. Create some lumbar extension even here. And what does that take? That takes your pelvic floor muscles actually engaging. It takes initiating your core to move the pelvis to tip it down. So we did all that articulation on the ball with that clock visualization for a reason, so that you can start to be more aware of what is moving your body and how it's moving. Use the same arm as the leg that's up as leverage to open that thigh out to the side, deepening that stretch in the outer hip. Hearing your breath. On your next exhale, go ahead and uncross that leg, bringing it to the ground, and switch sides. You can switch the band, bringing it around the other leg's thigh and using it to pull the leg. Sometimes it's hard to grab the hamstring and thread the arms through. You end up bringing your upper body up, and then that's taking you into that flexion and kyphosis position that we want to avoid. So we're breathing here. We're allowing ourselves to open up a posturally tight area. Let's come back to that. Let's do 3 count breathing, and you can decide which you like better. We did our 5 count breathing. Inhale, 2, 3. Exhale, 2, 3. 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 Inhale, 2, 3. Watch out for the pelvis. Tip it down. Take a hand under the low back and check. Can you get a hand under your low back? You need to tip the tailbone down. Decrease the range of motion. That's why you should be using the loop band if you're unable to grab without rounding your low back. That loop band gives you that extra space and control. On your next exhale, slowly take the legs out of this cross position, and we're going to move into some calf flexibility. We're going to need either a foam roller, this is going to be less aggressive, or a trigger ball. It can be a lacrosse ball, it can be a tennis ball. They have like those massage, like crystal balls. It can be any of those as long as it's not too intense. We're going to start with our dominant leg. You can do this 2 ways. You can be on your knees if you don't have sensitive knees, and you can sit back onto the ball, bringing the ball, wedging it between the knee, the hamstring, and the calf. Or you can stay seated and elevate your pelvis by hands on the floor, lifting the butt up and rolling into the calf. I want you to do one at a time though, starting with the dominant leg first, and really get into that central calf up near if you're sitting back on your heels, start right up near the knee and get into the fascia. And you kind of have to play around with the tender areas. You may find a little more laterally up near the knee, around the peroneals is very, very tight and tender. And if you don't have a lot of range of motion to sit back on your heels, you can dorsiflex your feet and get kind of a stretch for your toes here at the same time you're working the calves, tucking the toes under. We'll be here for another 30 seconds. So hear your breath And remember, if you're seated and you're rolling out the calf with the foam roller or the ball, dorsiflex the foot, both feet. We want to continue to do that, keeping it nice and active, combating the plantar flexion in the ankles. Another 15 seconds. Breathing. And when you find a spot that's tender, give it at least, 10, 15 seconds of breathing into it. Get into that fascia, loosen up those knots. It's called self-myofascial release, and it's excellent for increasing range of motion. Go ahead and switch sides. Just so you can understand your body more, flat back posture has the most flexibility issues, but it has the greatest strength. So we have to focus more on flexibility with flat back posture so that injury doesn't occur. But it's imperative that you work on your core strength and your upper back strength and the quads and the hip flexors to balance out those overactive hamstrings and those overactive calves and even the pecs that are pulling you forward into kyphosis. So we got to stretch out the pec minor and the anterior delts. You're doing great. Another 30 seconds here on the non-dominant side. Now, if this side is significantly easier and you're not finding spots, feel free to go back to your dominant side and get into those tender areas if there was a big noticeable difference between one side and the other. And we're breathing. Let's do another 10 seconds. And then we're going to rise up onto our knees for the next exercise. Now, if you have sensitive knees, you can pad your knees, or you can come to do this exercise seated in a chair. Either is fine. Let's bring the anti-burst ball between our knees, and we're going to tuck our toes under, really working the feet here. Rise up on your knees like you're standing on your knees. Tuck the toes under, just stretching the tops of the feet out. And from this position, I just want to work on, and it'll be an active way of stretching the anterior delt and pec minor, retracting our shoulder blades. So what I'm going to have you do is inhale, prepare, exhale, pull the shoulder blades together, retracting them, hold 5, 4, 3, 2, 1. Inhale, let them go. Exhale, retract 5, 4, 3, 2, 1. Inhale, release 2, 3, 4, 5. Make sure you're squeezing in on the anti-burst ball. It's between your inner thighs. And exhale, retract 2, 3, 4, 5. Inhale, release. And as you release, don't allow collapsing. Just allow it to come back to a neutral position with the pelvis still pulling down towards the floor, side body long, abs engaged. And watch out for rounding your back here. Even tip your tailbone back here, create some extension. Let's do 2 more. Inhale, prepare. Exhale, retract. 2, 3, 4, 5. Inhale, release. Exhale, retract. 2, 3, 4, 5. Inhale, release. Wonderful. We're going to make our way up to a standing position now. And we're going to take a gastrocnemius stretch facing the wall. So hands on the wall. You can set the ball down and start with your dominant leg, stepping it back. So we get into that gastric first. Pelvis is forward. Watch out for the head falling towards the chest. Keep it up on the spine. Plug the shoulders down the back. And imagine I'm there and I've got your pelvis and I'm pushing it forward towards the wall. And as I push it forward, you pull your lower abs in and you kind of resist my pushing you forward by tipping your tailbone back, countering the movement I'm doing. So there's this kind of push-pull feeling. And at the same time, the pelvis is still pulling to the ground. That back heel is getting an excellent stretch. Keep breathing. Go ahead and internally rotate that leg, getting even deeper into the peroneals. And if that doesn't feel as tender, stay parallel. Typically the gastric is a lot tighter than the peroneals for flat back, but if you do have flat back with a little hyperextension in your legs, you may have some tight peroneals that need attention. Another 30 seconds here. Keep your focus up eye level, pelvis pushing forward, abs engaged. Watch out for the torso kind of rounding or pitching forward. Even here, engage your upper back, use your core. That's what we're working on. Go ahead and switch sides, setting up on the other side. Pelvis driving forward, abs pulling in and up. Hearing your breath, inhale and exhale. So inhale, ground, exhale, go a little deeper into the stretch. We're going to come back to that breathing, eyes open or closed. We'll do somewhere in the middle. Let's go inhale, 2, 3, 4. Exhale, 2, 3, 4. Inhale, prepare by pulling the pelvis down. Exhale, go deep into that stretch. 2, 3, 4. Inhale, ground yourself. Exhale, deepen the pose. 2, 3, 4. Inhale, ground. Exhale, deepen the pose. And last one, inhale, ground. 2, 3, 4. Exhale, deepen. 2, 3, 4. Wonderful. Come very, very close to the wall, facing it. Bring your dominant arm out to a T. And we're going to twist away, pec major stretch. You can actually do a cactus or a T, and you'll basically get the same area. Typically, if you take your arm up into a high V, you can get more of the anterior delts and the pec minor. The pec major is usually accessed more with this cactus arm or this T arm. So wherever you feel tighter, top of the shoulder or more in the chest, you be the judge of that. We're going to be here for a minute and a half on our dominant side. And there's a tendency for the head to kind of tilt and drop to one side. Center your head on your spine, plug your shoulders down. If your neck is straining, you can always do some circles of the head to relax the neck. You can lift the chin up. You can look down. If you have no upper cervical issues, you can do flexion, tipping the head side to side. And breathe here. So even here, knees are soft, feet are hip distance apart. Outside arm, feel free to do some shoulder circles back if it's kind of like, what am I doing here? If it feels like it's kind of tense, breathe. Go ahead and switch sides. Face the wall. Gives you a little more leverage if you start really close to the wall. Your choice, pec major, chest area, either a T that's shoulder height or the forearm and the outside of your baby finger and hand is on the wall. Either way, you're going to get into your pec major, or you've got a nice high V with the inner edge of the thumb and wrist on the wall. So it's more of an internal rotation. You get the pec minor this way and the anterior delt. Wherever you are, honor yourself and breathe and watch out for the head falling forward. Keep it up on the spine. We can look a lot more confident than we are if our head is lifted and our collarbone is wide and our shoulders are gliding down our back. So often when we can create that body position, it translates to our nervous system and our emotions as well. So can be a wonderful way to boost your self-esteem just by how you carry yourself through space. Excellent. From here, we're going to make our way to the wall. Final active flexibility stretch, cactus imprint. I want you to stand with your back against the wall. Your feet can be about a foot forward, imprinting the tailbone, the upper back, shoulders, head. Arms are in cactus. You've got the back of the upper arms, the wrists, and hands against the wall. Close your eyes here. Inhale. I'd like you to try to deeply imprint your shoulder blades into the wall. And notice as you do this, what happens. Do the shoulders elevate? Can you plug them down and still get that imprint of your upper back? Do the front ribs push out? Can you keep them soft? I like to think about my sternum reaching for the center of my shoulder blades that I'm retracting. And this helps me combat the kyphosis that happens when I think about my chest going inward. So it's kind of a double-edged sword. Your body's gonna want to go into kyphosis when you soften the chest, but you have to also think about the retraction of the shoulder blades. One more breath here. Inhale. And your arms can slowly make their way down, stepping away from the wall. Great job.